is the best thing for me, it's got to be too good to be true. So I think the two main things that are unique challenges to the Black community as it pertains to HIV and kind of healthcare in general, poverty / excess and trust.
Hey, what's up? This is Corey Dion Lewis, clinical health coach and host of the Healthy Project podcast. Now, the research shows that social determinants can have a greater impact on your health more than healthcare or lifestyle choices. The purpose of this podcast is to discuss how to improve health and reduce health inequity by speaking to healthcare professionals, thought leaders, and entrepreneurs. Now, if you're enjoying the podcast, give it a review. Or you can also make a donation to the Healthy Project using the link in the description. It takes 30 seconds and it's super easy. Hey, thank you so much for listening. Now let's get started. Listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. I got a dope guest in the building with me today, Eugene Green, that is doing great things and bringing awareness to health. Thank you so much for being here.
Corey, yeah, man, I really appreciate you having me. This is an amazing opportunity. And, working with you, even to get to this point, it has been an amazing pleasure. So, yes, I am Eugene L. Green, and I've worked in the healthcare marketing and sales arena for close to almost 20 years. But I'm not a healthcare professional. I am not I'm not public health certified. However, I'm a public health advocate, which makes me a human health advocate. And overall, guys, my goal is to get all of us to think about public health in that same way. So because February 7th is National Black HIV and AIDS Awareness Day, I thought this would be the perfect opportunity to not only raise awareness, but put a little bit of that responsibility back on the Black community to just take better care of each other. So really appreciate the platform, Corey. And let's talk about it.
And, one thing I want to say, too, before we get into it, we need a lot more people who, just because you're not in the public health space, you don't have a healthcare or a health and well-being background, doesn't mean you can't have the conversation still. So
True.
This is super, super important. And I believe people really identify or love those stories or conversations more so with those that aren't in the profession than they do listening to people who are. So this is a great opportunity to reach some people that necessarily wouldn't have been reached, but before we jump into that conversation, can you tell the people a little bit more about yourself and what gets you up in the morning?
I think it's the, as far as, what my why would be, it really is about, making sure that we take better care of each other. And I do think that believes, that starts right under your own roof. So make sure your family's, healthy and safe. Making sure that, and as you kind of step out of that door, making sure that people in your block, in your community, if you're in a cul-de-sac, the people that are that surround you are people that are like-minded and that, you guys are supporting each other. And then from there, and as we talk a little bit more, one of the things that I try to make sure is completely understood, it's about pollination. So we have this conversation and let's say 100,000 people, what they're viewing our discussion. One person and only one person, pushes it forward. That's completely fine. They'll take that. They'll talk to their buddy. They may say, hey, man, to go back to the HIV part of it, you're living kind of a high risk lifestyle. You should get tested. And by the way, I'll go with you. So we kind of like, from a Black community perspective, let's be better partners. Let's take better care of each other. Let's have it start with under your own roof, whether it's, just you and your partner, you have a larger family, whatever, because, that's an opportunity to always have some of the little ones, maybe your spouse, whoever, to walk out the door and say, hey, listen, just a real quick conversation. Here's what, we believe in regards to, being a better human health advocate.
What are some of those of the unique challenges faced when we're talking specifically about the Black community when it comes to HIV awareness and prevention?
Yeah, I mean, that's a really good question. I think there's kind of like 5 primary legs to this. It's racism, it's the HIV stigma, it's homophobia, there's poverty slash access, which I combine as one. We'll talk about that in a second. And then there's
Mm-hmm.
trust, because we don't trust. And we have had historically plenty of opportunity not to trust. So, I'll start
Right.
with racism and being black. Being black is never a good thing in America. That's been a problem for 400 years. That's not going to go anywhere. That's a separate podcast. So we can't change that. The stigma around HIV and homophobia, it's not necessarily unique to the black community. It's exponentially more magnified. It's more almost like celebrate is the wrong word, but there's a there's a thing in our culture and outside of our culture that you turn on a movie. I do want to drill down a little bit on poverty slash access and trust, and I connect those two because as far as poverty and access, because access is based on means, and if you don't have the means, you can't gain access to stuff, and it's really just that
Right.
simple. That's not necessarily even as much a black and white thing. So, for example, we all had the best friend back in the day, the little homie that we grew up with, went to school with them. We spent lived next door. That was our road dog. We were like six, but that was our our little homie.
Right.
And one day you come around the block and there's a moving truck there, and you're like, oh man, little eyes get watery, and you're like, well, where y'all going? And he's like, oh, we moving. And but from being from Philly, the natural reaction would be to the county. That means like to the burbs. So you say
Mm.
you're from when you're from Philly, you say, y'all moving to the county? And you say, yeah, man, we getting out of here. So that's okay. But that also means that, dad got a promotion, mom got that degree, and they've afforded themselves the means, have given them access to better schools, potentially less crime, and of course, healthcare. So, and that brings me to poverty. When you are poor, whether it's a rural situation or an
Mm-hmm.
urban situation, if you are poor, you don't have access to things that are going to be best for your health and your community health in general. I mean, we can even talk about Flint, Michigan, and Jackson, Mississippi, I believe. And if I got those two cities incorrect, apologies, but they can't even get access to fresh water, let alone
Right.
proper health care. So I think the health the poverty and the access, that is a critical piece, because in poverty stricken areas, no one's coming down to save the day. So we do, from a community perspective, have to figure out, support each other, and really go to the people that can make a difference. The trust factor is also a big issue because, like I
Yeah, I
said,
was going to say that.
yeah, historically we've called a raw deal in many situations when it's come to medicines. We have been human guinea pigs, and the trusting is it really. If you even put HIV to the side for a minute, I visited a large chain pharmacy maybe just a few weeks ago. They had a large sign for shingles. Get vaccinated for shingles, and this
Right.
is in an area that the code is a demographic that's is aging. There's a lot of Medicare, Medicaid people. People ain't really necessarily balling in this area. So I was kind of optimistic, kind of glass half full, asking, "Hey, how many vaccinations do you do per day?" And she was like, "Per day? Nah. If we get 2 a week, we're very lucky." And we
Wow.
talked about it a bit more, and it was basically around number one: if you do have a PCP, they're not making a move without talking to that physician, because they're not going to trust that whatever is in that syringe is the best thing for me. It's got to be too good to be true. So I think the two main things that are unique challenges to the black community as it pertains to HIV and kind of healthcare in general: poverty
Yeah.
slash access and trust.
Yeah. You said something that really stuck out to me that puts is almost the umbrella of everything that you were saying around trust, access to proper care and prevention. Being black in America to begin with already puts you at
That's a problem.
it puts you at a disadvantage to get that care, not only because of the stigma of how people feel about black Americans in this country, but the trauma that we're carrying from our past family and
Yeah.
ancestors, where we automatically don't trust
Mm-mm.
anything, right? It's even hard to trust someone of color in the field telling you that it's the right thing to do. It
Yep.
almost feels wrong. And you also said something about the Black community needing to, and definitely correct me if I'm wrong how you said
Yeah,
it, but the Black community needing to kind of step up and help our own community to make sure that we're getting the proper care that we need.
for
And
sure.
I would love that your thoughts on this question is, or not even really a question, but the statement of, man, that is a huge burden to carry, a necessary one, but I feel like that is so it's a lot to do.
It's
It's
a
a
lot to
lot
do.
to carry that burden to make sure that everybody in this community is cared for. I'm not saying it can't be done,
Yeah.
but when you said that, I was like, you're right. But whew.
It's a that is a it's a feat. It's a Herculean feat. It's a big thing to ask. I will say this, and I think this is an incredible conversation because HIV is really, really the perfect health condition because it intertwines through the Black community very silently, but it's always there. Things that we do in the Black community that are a lot of work, but we feel like they benefit all of us a great deal would be things like I coached basketball for a very long time, youth basketball. And the way that our community would come out and support those kids was incredible. And for me, public health is not just HIV or COVID or diabetes. It's fitness and healthcare and diet and those types of things. And the way they would come out, not only for our small basketball league, but for some of these massive AAU leagues, it is unbelievable. So we can rally around situations that we think are important to our community. Now, whether we think like that little guy's going to get paid and come back to the hood, that's regardless of any of that stuff. But we can when we feel like it's that important to us. And so the real challenge is not about can we, it's about making it important. Like there's people dying. And as much as, there's a lot of community activities, whether it be sports related or non-sports related stuff that we do well. I mean, we do in the Black community with a rap for life. We don't do anything well. It's just a mess all the time. That's not necessarily true. Our family is on the front lines for like voting. If there's a voting situation, an election happening, whether it's local or regional, political, national, we're out there, and people come in big numbers. So when it's important to us, we do make the effort and we rally around a cause and a situation to make that happen. HIV's not been there. And I think there's a number of reasons for that, but I would love for that to change, just like any other chronic health condition.
Yeah, when I've been doing a lot of work within the mental health space lately, and
Yeah,
when doing some research on that space within the Black community, the word stigma comes out a lot, and the stigma behind mental health. And I believe, I think that stigma, when it comes to certain things like HIV,
yeah,
mental health, is a big barrier for not just the Black community, but other communities that maybe feel that stigma too,
yeah.
to really make a push to bring more awareness.
Yeah.
How do stigma and discrimination within the Black community, how does that contribute to the spread of HIV?
I think, being Black plus the HIV stigma, like those two things, segregated are difficult things. You put those things together and into one person or into one community, and you're automatically going to have there's a layer of like hopelessness that's created. Like no one cares anyway. Like they didn't care if I was one or the other. Like I would already have a hard time like getting what I believed I deserved as a human being in this country. But those two things together automatically generate a level of hopelessness. And then when we have that, when that stigma happens and you have no hope, it's easy for other people, around you to feel like, well, why should I care? I guess that person doesn't care. No one cares. The way I put it into my brain is like the crack epidemic. That was an epidemic. That was a public health situation. It still actually exists. It's the faces more of opioids right now, but let's stick on crack because crack is considered at least a Black people problem. And again, to take it back to the hood, there's plenty of times, and I was guilty of this just as much as anybody else. You know, that person became a crackhead. You see that person sitting on the curb. Now that person's not worthy anymore. Like, you're like, wow, you did that to yourself. And so that's something that, whether it be crack, HIV, etc., we have to be better as a community. That person still has worth. That person has stumbled into not a great situation. But, just like with crack, the HIV, there are innovations, there's medicines, there's PrEP, there's things in place now that can drastically help a person, not only from a lifestyle perspective, but a life expectancy perspective. But the only way those things kind of happen is to, embrace that person, those people, those situations in your own community, and make sure that, it's not hopeless. It's a tough spot, but someone cares. And if one person cares, that's a reason to get up in the morning and do something about your situation.
Right. Just because that person maybe is going through some hard times or got into something like a lot of people went through during this, crack epidemic, there's still value to them. And maybe we should,
Yeah,
yes,
there's
we shouldn't
extreme
lose
value.
that.
And I mean, you can compare it to, not even anything is I guess drastic as HIV or whatever, losing a job. Like, that will hit different people in a different way. And you can look at a person, you saw them last week, they lost their job, you see them the following week, and you can see just a drain and a layer of hopelessness and a layer of like despair and like, what do I do now? I'm especially from a Black male perspective. A Black man loses his job, and you're definitely you're feeling like, I'm out of the like my worth is questionable, and that's not the case. That's a much easier situation for us to embrace, because everyone can relate to wanting and needing a job. Everyone cannot relate to being a crackhead. No, I'm just going to keep it real, being a crackhead or HIV. So when we can't relate and we don't understand, it becomes scary. Please stay away, and those people lose worth. And like anybody else that needs help, it does come back, and that's why I try to kick off. Like, a lot of this is our responsibility.
Right.
Like, we have to take better care of each other, because there's no other group breaking down the door to be like, yo, I'm gonna save y'all. So yeah,
Right. Do you think, and this question just came to me now, do you
yeah,
think maybe a small part of the reason why some of us, and I'm going to take responsibility and say I'm one of some of us, is when, when thinking about HIV in our community,
yeah,
you've heard rap songs about Magic Johnson.
mm,
You've it's been made fun of so much
yeah,
that it almost loses some of the severity to it. Like,
yeah,
we're making fun of it about, HIV ain't real, look at Magic Johnson. Or
yeah,
I can name 3 or 4, you know, r-
yeah.
bars right now talking about that.
Yes,
You know what I'm saying? And then
absolutely.
it loses some of, like, HIV is still real. This is still killing
It's
cats
so
out here.
very real.
You know what
I
I
think
mean?
I do.
It,
I do. I think two things have that kind of caused that layer of we become a little bit desensitized to the impact and the realness of what HIV is. And I think there's two things. One, the migration of HIV. When HIV was in LA and New York, everybody was just going crazy. It was a big problem. It was also a white people problem. Whether you're gay or straight or whatever, it's everybody's problem. But then it started to migrate to the South, and the one thing that happened, well, a couple of things happened with that. Once it started to migrate, people here, and LA and also Chicago, but New York and the general northeastern part of the country, we control a lot of the narrative of what a thing is. So we're like, oh wow, there's less AIDS here. Things are great. That doesn't necessarily mean that AIDS hadn't found a new home, and it did, and it's very, very comfortable in the South. And you know, because of that, because of places like the places in the deep South, Louisiana, Mississippi, Alabama, they get much less general, press coverage, much less media. those stories aren't really told as often and as loudly. It's easy to get sucked into the idea that, and plus with a lot of the innovations, I have to give credit to a lot of the companies that are, in the forefront of creating medicines and solutions that have been helpful. Like the numbers have dropped a bit over the past, I'll say 5 to 7 years. Because of that combination, it feels like it's not a big deal, and we can make funny rap songs about or include funny, or interesting lyrics, because none of it's funny, about Magic Johnson and different songs and those types of things. So I think part of it's because of the migration, and when it migrated, it landed in a place, primarily, not solely, in a place where no one cares as much. There's much less media coverage in those areas. The people that run those states, they'll still blame HIV on you and start to thump the Bible. So those areas really kind of can't win. The narrative is created naturally that, we're out of harm's way, but in the Black community, there's still people dying. So I think that's a large part of it as well.
Right. No, that's real. So, I mean, as you're aware, when, 2019, 2020, COVID hit the scene and it felt like every disease in the world didn't exist anymore.
Yeah.
um, how
Yes.
has COVID-19, how has the pandemic affected HIV education and
Mhm.
testing within the Black community?
I think, I'm a glass half full guy. I'll say long term, COVID will be a good thing for a lot of things. And I quite honestly, Corey, I think you and I may have talked about, and I've talked about this with people really openly in the past. I didn't know much about public health until COVID. I thought that was a
Mm,
thing that people did when they couldn't get into medical school. And as I'm learning more about it based on, COVID, I'm like, oh, wait, this is really very important. And by the way, it's bigger than just COVID. Like it's everything.
right.
I started to think back on like, smoking and all types of other air, even wearing your seatbelt's a public health situation. So I think COVID long term is going to have a great impact. In the short term, it's been horrible for HIV, and it's not only been horrible for HIV. It's been bad for a lot of the testing around a lot of chronic conditions. And it's working in the space that I've worked in for many years, and talking directly with a ton of brand managers and brand leads of different pharmaceuticals and healthcare organizations during that window of time, 2022 to kind of like 2020 to kind of like right around now. From a bottom line perspective, it did affect a lot of their numbers because people got tested less for colonoscopies. People got tested less for, didn't get their PSA for prostate. People got tested less for ovarian cancer, screenings, those types of things. And, people became more sick than they should have. And unfortunately, some people, excuse me, passed away because of those conditions. And then there's HIV, which was already in the back seat. COVID put HIV in the trunk of the car. So it was
Mm,
already not like a thing that was, in the forefront. It really did give it a boot. So optimistic. COVID caused created this platform for me. Like I would not be talking about this because I would not been still not been thinking about public health in this level. You and I wouldn't have connected, and I wouldn't be
right.
doing my small part in creating this bit of awareness and accountability. So COVID has done that, and hopefully these types of conversations again will continue to pollinate and keep working through that. But in the short term, it's been bad. Numbers went backwards a little bit, and even as I was kind of digging through, just some information and a little bit of data. Even the CDC, they have data up until like 2019, 2018, 19. And then there's like little, footnotes that are like, oh, hey, well, due to COVID, our numbers are all messed up. And I'm like, what? That was like 3 years ago. Like your numbers are still messed up. You haven't updated paperwork yet? Like this,
Right.
anybody, a lot of the information and the NIH, CDC, FDA, whatever, incredibly strong and valid information. So when I saw that, I'm like, wow, well, they're way behind on how HIV is tracking right now. Then that's a problem.
Yeah.
So I think long term, yeah, I'm going to give it a thumbs up. Short term, it's not been good. And then even if you think about, remember during COVID also caused me to fall in love with CNN. So and I've still not been able to shake that addiction. But remember, every day there were White House briefings for hours about COVID.
Yeah.
You were being
Yep.
educated. You were getting Fauci and some of the other, healthcare leads in this country.
Man.
We're
Yeah.
getting pounded over the head with how important COVID is and what's happening to COVID, COVID. Can you imagine if that happened once a week, once a month with HIV? And the level of like conversation it would generate and the level of exposure and the level of, and I know years ago when HIV was actually a thing in most people's mind, we did have a mild layer of I'll just say White House coverage, but nothing like COVID. And even
Right.
if they made it regional, if they say, hey, listen, we're going to do this down south every day at 5 o'clock on these particular news channels, we're going to talk about HIV for 15 minutes. I mean, can you imagine the impact that would have? It would be
Right.
incredibly
Right.
important to a lot of people.
No, that's real. That's real. And with HIV Awareness Day right around the corner, what can we do, or what can people within the Black community do to work to educate and empower themselves, and to take
Yeah,
control of their sexual health, and to reduce the spread of HIV?
I think it goes back to something I mentioned a little bit earlier, taking better care of each other, and I think in the same way that we get on the Peloton every morning, the same way that we work together to eat less salt, the same way that we probably we work to get better or more sleep. These are things they're going to benefit you personally, because they're going to benefit all of us. You being around, you being healthy, you being strong is going to benefit all of us. And so when it comes to being able to take care of yourself from an HIV perspective, or take care of a friend that may need a partner in order to take care of themselves, which translates into taking care of the community, then you should do that. And so I think it goes back to the accountability part. Let's take better care of each other, number one, and then two, you got to approach it as either an existing, if you have HIV, an existing chronic condition. If you do not, something that you don't want. In the same way that I'm not
Mhm.
looking for, I don't want diabetes, and I don't want high hypertension, high blood pressure, heart disease, whatever. Especially if there's a potential of like either you're at high. Those are things sometimes that can be family history based, but then things like HIV, no, but they are risk based. Let me
Mhm.
put myself out of harm's way. Let me maybe change my not orientation by no means, but the crowd that you're on with, that might
Right.
be helpful, because again, someone cares about you. And if I decided that, hey, you know what, I would love pizza every night. Every night,
Right.
super, super salty every day. And that'll make me really, really happy. And I might not be around very long, but that would be a really selfish act on my part. The other thing that I think is really incredibly important, and we have some layer of control of this, although it's a little bit trickier. It's either our response, we can take some responsibility for this, and or people that can make change in this area. We got to start talking to our people where we are. So, for example,
Mm.
Black people watch a lot of TV. I'm not making that up. That is a hardcore fact. Our demographic, we love TV. We watch TV more than anybody else. And I have to thank a very, very close friend of mine. She is the founder of a group called the People, but she's also the queen of all things TV. And we had a conversation about it, and she said, "Yeah, this is a real thing, but it's also a real opportunity." So when I say the queen of
Mhm.
all things TV, linear TV, connected TV, OTT, which is over the top television, as well as advanced
Mhm.
TV, because of the way we consume content. If
Right.
if there's an opportunity to get in front of you and there is a TV or a TV type object, Black people are watching it. So so marketers know this, advertisers know this, which is why when you are watching, BT, VH1, or really many different types of channels, and also depending upon what platform you might be on, they target you. There's zero party data involved. They retarget you, and you're seeing HIV ads constantly. That's fine. That's great. But we don't see the PSAs. We don't
Mm.
see a lot of the things that we used to see. And I'm a little, a little older than you, but I remember some of the public service announcements that would come on TV that I still remember, like it's the back of my hand, like give a hoot, don't pollute. Like that's like 40 years old. But if you
Man,
were a person of a certain age, you will never forget that. We remember Smokey the Bear. We didn't even
right.
live near forests, but they kept telling us it was important not to start forest fires. We ain't got no trees. But
Right.
for some reason, you keep telling us about forest fires. And then the number
Right.
one thing I think about all the time when it comes to like we could be doing this for HIV. No brand associated, no nothing, just hardcore shock value on getting tested was this is your brain on drugs. Everybody, if you know that ad, if you know that
Yep.
PSA, you know that scrambled egg and that frying pan and that imagery is just implanted in my brain. So
Right.
again, imagine if there was a group of black people in a particular community. It's not very expensive to buy ad time on like cable network. That's not that's relatively affordable. Or an organization, or just anybody that said we need that same type of impactful PSA, no brand involved. Just like, listen, guys, something catchy, whether it's visual or words, TikTok, who knows, but that pushes home the fact that testing is important. Because I look at these numbers and I'm like, oh yeah, numbers are down based on the number of people that have been newly diagnosed, and I'm like, well, those are the only people that have been reported, or if they're or have been diagnosed. There's a bunch of people walking around town that if they saw a PSA like this is your brain on drugs, any questions, it may cause them to do once again talk to the buddy like, man, we gotta get tested. Like
Right.
we had a wild weekend. I don't know. So
Yeah.
um, I think there are, and that's why I don't want us to expect that someone white's going to come swooping down with a cape on and save the day and fix all of these things. We really do have to, from the inside out, identify opportunities, meet each other where we are, take care of each other, and make human health a priority.
No, that's real. That's real. Eugene, thank you so much, man, for being on the podcast with me today. I really appreciate that.
Really appreciate this.
Anybody, yeah, man, anybody listening that wants to learn more about you, connect with you, and just rock with what you're doing, where can they find you?
Yeah, so myself and the amazing Dr. Bio Curry Winshaw, I believe you know relatively well. We just
Yes, I just
launched
interviewed her on
a
the podcast. She's
she's
dope.
incredible. That chick is way dope. And so we just started a DE&I health focused video series called Healthy with an Attitude. And it's just our way of trying to support a healthier lifestyle, raising condition awareness, and then it goes right back to public health, like making that all of our responsibility. Just launched in January. Second video came out just only a couple days ago, early part of February, and the response has been incredible. It's on LinkedIn, and you can find me on LinkedIn and actually Twitter by searching Eugene L Green. These videos are also on Instagram, Eugene LG, and then TikTok. When she's more of a TikTok person, I am, but I'm out there and you can find a video and TikTok is Gene Green 9. So this has been an amazing opportunity. Really appreciate the forum, appreciate the microphone. And yeah, man, if we can just start to pay it forward, push it forward, help one person at a time, get the black community in the mindset of like, yo, it's not me versus you, it's me and you, then I think
Right.
we'll have some really, really strong patient outcomes.
Man, that's real. That's real. It's me and you. I really like that.
Sure.
Again, Eugene, thank you so much for your time.
For sure.
And everyone, thank you for listening to the Healthy Project podcast. I'll let you next time.